Hello, my name is Thomas Gray. I'm one of the Clinical Education Leadership Fellows based in South Yorkshire. I want to talk to you about Healthcare Supervision Logbook, which is a new smartphone app which has been developed by myself and Professor Farrell over the last year and a half. Healthcare Supervision Logbook is a smartphone app which has been professionally software engineered. This has been funded by Sheffield Teaching Hospitals NHS Foundation Trust. This presentation includes a number of screenshots, which are simply pictures of the screen of the app, and I'm going to explain its function and how it works. It's an app that is secure, so you need a username and a password to use it. This is what it looks like as you're turning it on your phone. There's also a desktop version that is available, but we envisage that the majority of people will use this on their smartphone. This is the home screen, which has the menu. There are 4 menu items. There are 2 different versions of the smartphone app. There's a version for trainers and there's a version for trainees. The smartphone app has 4 menu items if you're a trainer: logbook, sessions, training and patient, which is going to be renamed surveys. And if you're a trainee, you don't have the training section of the app. As I've said, it comes in a trainee version and a trainer version, and it has 4 main functions. It's a way for trainees to provide feedback about their perceived value of the educational content of a clinical session they attend, including their perceived value of the educational supervision they receive. It's a way for trainers to provide feedback about a trainee's performance in the session, and also has a logbook function and a way of collecting patient and colleague feedback for purposes of revalidation. I'm just going to briefly go through these different functions. The sessions section of the smartphone app is used by trainees to provide feedback on their educational and clinical supervision that they receive during a session. They provide feedback on their perceived value of the content of the session, including their educational and clinical supervision. The feedback form that they fill in on the phone provides details about the time of the session, so whether it started or ended on time, details of the session such as the number of new patients they've seen, the number of follow-up patients they've seen if it's a clinic, if it's a theatre session, the number of minor cases and major cases they've performed, and whether they were able to see the patients post-operatively. There are also questions about whether they received feedback during the session and whether they were offered work-based assessments. And there's also a question about undermining as well, whether they felt undermined during the session, if so by whom, and whether they've reported it or not. Currently this is anonymised for trainers, but there is a possibility to name trainers in this function of the app. This is an example of what it would look like. So you can see here this is a theatre session feedback. They've already commented on whether the session started or ended on time further up here. The number of minor cases, the number of major cases, whether their surgical training was affected by things like complications, a consultant decision, or time pressures, whether they were able to time to see the patients post-operatively, and whether they were undermined during the session. If they report undermined during the session, they're asked if it was reported, and they're asked who they were undermined by, not in terms of names, but in terms of grade, so consultant, nurse, midwife, etc. I'll show you the training section of the app now. So the training section is used by trainers. This is used only on the trainers version of the app. The trainee is selected from a menu, and this is completed after each session to provide sessional feedback about the trainee's performance. It effectively provides daily multi-sourced feedback. I'll show an example of the feedback proforma that is used. So this is for a theatre session, so you comment on whether the trainee was punctual or not, whether the case mix was correct for them or not, whether work-based assessments were completed or not, and whether they were provided with feedback or not. We've also built in these 5-point visual analog scales on which they can feedback on the trainee's performance with regards to things like insight and clinical judgment, verbal communication skills, team working, and empathy and respect. We've actually subsequently expanded this so that it includes all the points that are included in the TA1 assessment at the moment. There's also a logbook function on the app. This is used by both trainers and trainees. The logbook is modifiable by specialty. It's currently mapped for obstetrics and gynecology, and it can be organised into different menus. The entries are timestamped. You're able to record the level of supervision and any complications that you've had, and mandatory items can also be included, for example, consent, or whether parts of induction have been done. This could be built into the logbook, so it could be quick to see if trainees have done these. There's also an option to add a video link to items to aid reflection, for example shoulder dystocia and postpartum hemorrhage. We're planning to link a video about gold standard management of those issues, of those emergencies, to this. So when a trainee is filling in that they've been involved in the shoulder dystocia, there's a little link prompting them to view a video which will aid their reflective process. This is a screenshot of the video of the logbook system. So you can see here they've selected obstetrics, labelled skills, fetal blood sampling. This is an example of what the screen would look like, saying whether they performed independently or not, whether there are any complications, and it'll comment about it. There's also an option on this to send a patient and colleagues a feedback form. So you can send a patient or a colleague a feedback form and they will be able to fill it in for you, and it will be collated on the system. So the feedback form is basically the same as the one that is on the GMC website, so it's a GMC validated form. This is an example of what it looks like. You type in the patient's name here and the patient's email, and you then send them an email with a message inviting them to complete the form. So you can use it to collect patient and colleague feedback for purposes of appraisal and revalidation. So the main take-home messages are, this app supports revalidation for trainers because the trainers can use the app to record their daily activities. They can use the session section of the app in a pared down way to record their clinical activities. They can also record any practical procedures they do, and they can use the app to provide evidence of the education and clinical supervision they provide. They can also use it to collect patient and colleague feedback for purposes of revalidation, and again that's GMC approved. The app supports training because trainees can provide sessional feedback on their perceived value of the training they receive. You can also use the content management system to highlight patterns and deal with issues that arise during training, and as I've mentioned, you can use it to detect undermining. You can also use it to log procedures and activities, and reflective practice is supported by the use of the app. You can also support appraisal for trainees by use of the training feedback section, so you get daily sessional multi-source feedback. And there's a content management system which is able to produce an individual report for a trainee, which with a summary of all their entries about them, comparing them to the other trainees in the departments, providing mean and modal average figures for them. You can also view the logbook entries using the content management system, and you can look at a large amount of data in a very easy and simple way. You've also got, so essentially this is a summary of the functions. It supports revalidation for trainers. It allows trainers to provide sessional feedback about the performance of trainees, and it allows trainees to assess their training session by session. It facilitates ARCP for trainees as well, and it will ultimately help to promote a culture of high quality training and education. I'll be very happy to answer any questions that you have about this.